Welcome back to Expresso here on SABC3, your feel-good breakfast show. Now it's time to take things in a more health-oriented route, and we're going to be talking to Dr. Chamendran Naidoo in a minute. But before we do that, penicillin is a common ingredient in regularly prescribed antibiotics, but can often result in allergic reactions. Dr. Naidoo is going to be telling us more about who should be taking it and who shouldn't be taking it, and of course, what are some of the symptoms that you would recognize if you do have an allergic reaction. Dr. Chamendran Naidoo from the Dr. Mark Show. How are you, Chamendran?
Very well, thanks. And you, Leah?
Very, very good. Is that your professional demeanor? I like that.
Only when you're around, Leah. I get nervous when you're around. Look at how you look.
Stop it, stop it. Well, how are you doing today?
Very well, thanks. And
That's
yourself?
good. We're talking about a very, very important issue today. A lot of people that I talk to say that they experience allergic reactions from the penicillin that's in their antibiotics. What is penicillin first and foremost, and why do people experience allergic reactions?
Well, penicillin is one of the oldest antibiotics that exists.
Yeah.
It was discovered by Alexander Fleming when he noticed that there was a fungus that secreted the substance that killed bacteria.
Yeah.
So he harnessed that substance, and today is the penicillin that we use to kill bacteria.
Okay. So how do we then notice that we are getting an allergic reaction to the penicillin?
Well, there's a vast array of symptoms that you can get depending on how severe the reaction is and how sensitive you are to penicillin. It can go from anything from a skin reaction where you get a rash, an itchy rash, to hives, to lip swelling, to even death.
Wow.
Yeah.
Okay, so is this something that people can then avoid? Is it a good idea to avoid it, or is it something that you should just continue using? How many people actually have an allergic reaction, and is it really what they think it is?
Look, it's actually extremely common. Penicillin allergies, they say about 10% of the population actually are allergic to penicillin.
Yeah.
But of the people who tell you that they're allergic to penicillin, like your friends, 90% of them who are tested aren't actually allergic because the allergy is temporary.
Okay.
So the best thing to do is to get tested for the allergy.
All right.
Now, avoiding it cold turkey is actually not the way to go. If you're uncertain, then the best thing to do is to avoid it, as opposed to experimenting with it and then ending up with dire consequences. So it has cost implications, and then there's the resistance issue, where if you use other antibiotics instead of penicillins, you're using like a second-line treatment, and that it promotes resistance, and it could be dangerous.
Okay, now is there any kind of test that one can do to see if you would have an allergic reaction to penicillin?
Yeah, the most accurate test is the skin prick test. And now how a skin prick test works is they take a little droplet of penicillin and they put it on your skin.
Okay.
And then they make an abrasion, so a little cut in the skin, and then they see how your body reacts to it. The most sensitive patients will react to the skin prick test, and that's a positive test. If you react to it, you're allergic to penicillin, that's that. Okay. If you're not reacting to it, then they do step 2, which is they take that same penicillin, they draw it up, and then they inject it intradermally, so under the skin. And they see how you react to that.
Right.
If you react to that, once again, you're positive.
Okay.
If you don't react to either or, case closed, you're not allergic, you can take penicillin with about a 5% chance of possibly getting a reaction, but all physicians will say, go for the penicillin.
Go for the penicillin. Wow, thank you so much, Chamendran. That was some really, really, really good advice. And I think that for anybody that wants to find out more about this, you can also go to Pick and Pay Pharmacy. If you want to find out about penicillin allergies, you can go and get yourself tested there. I'm sure you could do the skin prick test and things like that. Just to make sure, do you have to go to a doctor?
You actually have to go to a doctor. However, all your Pick and Pay pharmacists will be able to tell you or advise you rather on how the tests work, and tell you if the medication that's been prescribed is a penicillin.
Okay. Wow, there we go. Some really, really good advice, Chamendran. Thank you so much for coming and just, broadening our minds and our perspective on this issue of penicillin.
Are you allergic?
No, I don't think so.
Let's go for that skin prick, eh?
Oh, let's do it. I hate needles, though. I'm not a fan of needles, so we'll have to work on that. Thank you so much. Well, it's over to Good Hope FM. G Sport, they have got something very, very interesting in store for us. They always make us laugh. Love those guys. Over to you.
Goodness can be found in encouraging greatness at the Junior Runners Academy in Soweto. Pick and Pay, always there for you.